Hi, I'm Michaela, editor at the Manitoban. We're here at the Legislature, and we're going to talk to some organizers about organizing a rally for international student healthcare. Okay, tell me why you're here today.
Yeah, so myself and my comrade are here today to just show some support for the cause because, we're revolutionary communists. We believe in every single worker of the world and every person all over the world being able to access healthcare. Should be free for everybody, should be accessible to everybody. Doesn't make a lot of sense that international students aren't included in that. This is an important cause for us as it is for everyone else, so we're here to show some solidarity.
Has there been any updates from the government regarding this issue?
Not to the best of my knowledge. I believe the last update that UMSU was provided was that they're working on it. And I think, just that response, as a student union, we deserve more than that. We deserve a timeline that indicates when the government will be reinstating international student health care. It was cut back in the day through the PC government, and the current government, the NDP government, ran on that, so we'd love to see them fulfill their promise and hold them accountable.
How's this rally programmed?
So this rally was programmed in collaboration with the University of Winnipeg Students Association, so University of Manitoba Students Union and University of Winnipeg Students Associations. We got together, we have been meeting with the Minister of Advanced Education and Training, with different MLAs across the caucus, and asking them about this mandate that they have set out, but we haven't received any answers. So we thought that the next level of lobbying is protesting. So we wanted to work on the grassroots level and show that, hey, students are asking for answers, and that's why we gathered here at the Manitoba Legislature, so that the people that are working inside the building can hear us loud and clear.
How does this issue affect you personally and those around you?
Just this year alone, that was when I was able to afford to get my classes, and that is because I had to pay for a private insurance organized by the Student Union of Brandon University. If I were to fall sick, I can't afford to go to the ER. I can't even afford to get the ambulance, so that means I have to stay home if anything crazy happens. And we've seen tons of international students die this year because they can't afford to go to the hospital. It's affecting us personally. I have PCOS, I have endometriosis, I live in pain every year. Every month, I have to get naproxen over the counter to help my pain. I can't afford to see a gynecologist to help with this. I wasn't promised this. I'm paying a substantial amount for tuition here, and I contribute to the economy, and I deserve healthcare because I am human.
Have you seen any highlights here today that you'd like to share?
Well, the student speakers were just so impressive, and it's great to see the crowd here coming to support, whether they're skipping classes or not. Sometimes a cause is more important than missing a particular class. I taught university for years, and if my students skipped for this, I would be proud of them. It's just impressive how well these students can articulate what's wrong, can so bravely share their experiences, and use all that for this cause, and not just help themselves, but help other people. So that's really inspiring.
Is there anything else you'd like to add?
Healthcare is a human right. It's not a commodity. Privatization has no business in our health system. Profit has no business in our health system. Profiting off of international students for healthcare is wrong, and it's wrong at our university level that we charge them so much. But there is no economic or ethical justification for this exclusion, and the NDP knows that, so they have to get to work.
As an international student who calls Manitoba home, I have lived the uncertainty that comes with being uninsured. Behind every statistic are real people, students like me, who have faced moments of fear at the thought of getting sick or injured in a foreign country without support. What was lost was not a matter of arithmetic. It was a matter of humanity.
They recognize what we already know, that healthcare should not be a privilege. And yet months into their term, years into their term now, international students are still being left behind. We're not asking for special treatment. We are asking for fairness. We are asking for the basic security that every Manitoban deserves. The knowledge that if we get sick, if we are injured, if our health falters, we can see a doctor without fear of financial ruin. International students contribute so much to this province. Higher tuition, rent, work, we volunteer. We build community. We are your classmates, your co-workers, your neighbors. We are already investing in Manitoba's future, and yet, when it comes to something as basic and essential as healthcare, we are excluded.
You should not be worried about healthcare because you have a right. You are our future leaders. You're the future leaders of this province, probably your country. We need you to be okay, that you will not be sick and that you have to worry about paying money out of your pocket just because the government decided they're going to wait a little longer and probably not even institute it. I can tell you right now, the Liberal Party stands with you. We stand with you because it's the right thing to do. International health care for international students is a must. The PCs are the first government that took it out. And yes, Wab Kinew did promise that he was going to restore it quickly. Well, how quickly are we talking about here, right? You want to wait for another 4 years or something like that? That's not going to happen. We must demand that it is reinstated now.
We're not numbers, we're not fees.
We deserve healthcare if you please.
We're not numbers, we're not fees.
We deserve healthcare if you please.
We're not numbers, we're not fees.
We deserve healthcare if you please.
One thing that all of us here share is that we all believe that healthcare is a human right, right? Whether you're from UWSA, Red River College Student Association, UMSU, or from Manitoba Health Coalition, every single one of us that's gathered here today believes that healthcare is a human right. And if this government takes pride in saying that they're trying to fix healthcare, that healthcare is their number one priority, well, guess what? Healthcare does not have double standards either. If domestic students are able to access the healthcare system without having to worry about paying extra money, without having to worry about if they'll be accepted into the access clinic that they're going to, international students deserve the same right.
I've been elected now for nearly 10 years. And over the course of my time as a politician, I saw international student healthcare be cut completely, be then debated in the House. And I sat here in the legislature when the NDP were in opposition and they had no problem. They banged on their desks. They yelled at the PC government at the time saying, bring back international student healthcare. Yet now that they're in government and they have the opportunity to do so, they aren't doing it. And that's why I'm here with you today. I want to hold the government accountable. They said they were going to do this. We've heard it today. They've talked about it in their mandate, but then it's crickets. Whenever we raise it in the legislature, we don't hear back from them. We aren't being given answers. We aren't being given a timeline. And I believe at the very least, they owe you a timeline. I think they should reinstate healthcare right now for all international students. But if you're not going to do that, at least provide us some confidence that there is a plan in the works.